My name is Dave. I've been a firefighter here in Liston, Idaho for 33 years.
We have 3 sons, and our oldest son is a firefighter too. The guys love their job, love what they do, but it does come with hazards.
I started feeling like I just was wore out. Felt like I was just winded more than I should have been. We go to St. Joe's.
He presented to us with symptoms of heart failure mostly. The interesting thing about David was he wasn't responding to therapies like someone normally would with heart failure. And so it became obvious relatively early on that there was something more to his case.
He would have episodes where he would jump out of bed in the middle of the night, his arms way up in the air and gasping for air. And that happened 3 or 4 times and scared me and scared him. And
with my background and knowledge of what firefighters get, I was thinking, this isn't good. I mean, this isn't good at all. And Dr. Kim came down and said, we're going to take you to the cath lab. We're going to have a look at everything once and for all. We're going to find out what's going on.
So St. Joseph's is the only hospital within a 2-hour radius that has a cardiac catheterization lab. So we're the only hospital that is capable of taking care of patients with acute cardiac issues.
His heart failure was very much out of proportion relative to some of the laboratory values that I was investigating. And so immediately amyloidosis was on the differential for us. And I went back and talked to Dr. Kim about it and said, Dr. Kim, I have a really funny feeling about this. I'd really like to screen him and see. And Dr. Kim was 100% supportive and said, yes, definitely do that.
At this point, I'm getting sicker. I'm getting very short of breath, like I can't do stairs anymore without taking a rest. Noticeably sicker, like daily almost.
We then proceeded with a cardiac biopsy or myocardial biopsy, and that definitively proved that he did have amyloidosis, specifically in his heart.
Amyloidosis is a disease process that starts in your bone marrow. Instead of my heart muscle doing this like it's supposed to, it gets stiff and it gets oversized.
The fumes and all of those chemicals that they get exposed regularly as firefighters, even with the gear that they work with, it's well known that they can cause plasma cell-disc gracious, multiple myeloma, and amyloidosis.
90% will not make it past 6 months of diagnosis. I was terrified. This is how I was going to die.
We always say in cardiology, time is muscle, and want treatment as early as possible. Time is muscle.
Carly, our nurse practitioner, reached out to the cancer center and they got on board very quickly.
This is not curable. Is it treatable? Yes. How much time do you have? 1 day at a time.
One of the better days through this process is when you get the phone call and they tell you your treatment starts. That moment was where things turn the corner, I guess. It's either going to get better or it's not, but at least we're going to fight. We are in this for now. We are going to fight. The treatment for amyloidosis is chemotherapy and a couple other injectable drugs. When you first hear anything that's a diagnosis that puts you at a cancer care center, if you're not a little scared that this is how it ends, then you're a better person than I am. But we get to week 3, I'm really starting to feel better. And get to week 4, and I'm feeling a lot better all of a sudden. We get the first round of lab work back, and lo and behold, some of the markers are within normal limits. You get to see those numbers and you just get to feeling better, and it's like, all right, there's a chance we're going to get this.
It was a lot of teamwork that got David the care and the diagnosis that he needed, and the outcome.
If Carly wouldn't have caught Dave's disease so early, then it probably most likely would have spread throughout his body.
It was important that we made the diagnosis relatively quickly and that he got treatment relatively quickly. And now he's doing quite well.
He is starting to get that sparkle back in his eyes, starting to get the color back in his cheeks.
You feel more hopeful. So then you start setting goals, and your first goal is getting to my 31-year-old's wedding in July. Before treatment started, I didn't know if I was going to get to the wedding. And then you get to the wedding, you get home, and you start setting up long-term goals. We have a 16-year-old son that graduates in 2 years, so we got to be there for that. There's no all-out, if you will, cure, but complete remission would be our goal here. I believe we'll be on the winning side of this. You know, there's a statement of like, hey, if you're really sick, get out of the valley. You know, go to Spokane, go to Seattle. I never felt like I needed to do that. There are some very gifted, sharp, and very smart providers here in the valley. I can't stress enough how overwhelmed we've been by everyone in their professionalism, the compassion they've showed. I'm still here, able to talk to you because of the team at St. Joseph.